I'm sorry? I can't hear you, I'm sorry? You're with Mrs. C? Okay, so tell me, what's the other name for an opioid drug? What do we call that? Okay. Yeah, what's the name when we call it opioid drug? What's another name for that? All right, so somebody has chronic pain. How long in pain do they have to be considered chronic? How much time? How long?
6 months.
Excellent, yes. Okay. So know what that means. So somebody who's in a lot of pain, and their pain scale is, just so I can write this. Pain scale, what's the pain scale?
0 to 10.
0 to 10. Okay, so what about somebody who's 8? Would that be a lot of pain?
Yeah.
Okay, what about somebody who's in a 4? Okay. What would be described as pain for somebody that it comes and goes? What would that be called?
Acute.
Acute pain if it comes and goes?
Intermittent.
Intermittent, yeah, okay, so know what that means. What's chronic pain?
It's always there.
Like all the time, right?
Yeah.
For a long period of time? Okay, so know what intermittent pain is. What would be, we talk about the controlled substances classes. So when somebody who's taking heroin, what class would that be? A 1, 2, 3, 4, or 5?
First one.
Okay. Tell me a little bit about what cancer pain is. It's more, it has what? What about cancer pain? Tell us a little bit of information about cancer pain. What happens with cancer pain?
It's different for everybody.
It's different for everybody, right? Okay. Let's see. Can all patients with cancer have severe pain? Yes or no? No, okay. Is it considered chronic or acute? Yes or no?
Both.
Okay. If somebody's taking narcotics, would that be the only thing that can help with reducing cancer pain? Yes or no?
No.
Okay. How about cancer pain has more than one cause?
Yeah.
Okay, all right. Let's see. What is an opportunist infection? Tell me about that.
You have a weakened immune system.
What is it?
Someone has a weakened immune system.
Okay, weakened immune system, okay.
You said opportunist.
Yeah, know what opportunist infection is?
What is, you said when someone has,
Weakened immune system.
Okay, yep, very good, okay. What is the most common side effect if somebody's taking Percocet? What would be the most common? Excellent, excellent. So what do you want to always make sure that they have ordered with?
Stool
If they're getting a
softener.
narcotic. Stool softener, like a Colace. Okay, very good. What would be the most common drug used for kids with ear infections? What drug was the most common drug that they give? Anybody know?
Amoxicillin.
Excellent, yeah. Okay.
you said penicillin.
Amoxicillin.
Okay. What does it mean when we say a host related to infections? What does that mean? What is a host?
Cure.
The person.
What is it?
The person.
A person or thing that carries infection.
Okay, person infected by a virus, right? What's the reason why we give antiviral drugs? Why do we give those?
To build, so the person can build antibodies.
Bless you.
Thank you.
To suppress.
To suppress the immune system.
Okay. Right, helps
Suppress the
reduce the number of
virus.
viruses by preventing them from producing and growing. Okay. By keeping the
Suppress.
number of viruses low, antiviral drugs allow the body's natural defenses to destroy and eliminate it and activate them. Okay, so know what antiviral is, just drug therapy, what the purpose is of that. What would be the major way TB is transmitted from one person to another? How do people get TB? How is it how is it? Okay. Okay. Yeah, somebody say aerosol? Somebody say that? Yeah, okay, yeah, very good.
That was the major way TB is transmitted?
Yeah, how is TB transmitted from one person to another?
Is it airborne?
Yeah, is it airborne? Yeah, yeah. Would it be through unprotected sex?
No.
No. Okay, how about blood transfusion? No, right? How about skin contact with open skin? Did we get it that way? No. What anti-tubular drug causes the urine to turn reddish orange? You remember that?
Pyridium.
Okay.
Is that it?
Tell me what the answer is? Rifampin.
Rifampin.
Rifampin. Okay, rifampin is, so you know what rifampin is? And what does it do? It's, why it changes it?
So was it
Reddish
anti
color.
Anti-tubular drug, red urine.
And that will be in your book, let's see, okay, page 160.
It's on page 160. That's what she said. I'm sorry.
Okay, what side effect of chemotherapy puts people at risk for infection? What side effect?
slow wound healing.
What do we call that? When their blood levels go low, what happens? They become what?
Neutropenic.
Yes, neutropenic. So know what neutropenic precautions are?
I'm
It's a
sorry,
side
say
effect
what
of
the
chemotherapy.
original question, what side effect of chemotherapy
Yeah.
causes?
Neutropenic.
Is a side effect of chemotherapy?
Yeah. Okay, so just know what the side effect of chemotherapy is. It's neutropenic, so know what those are, what that is. And what is it, low what, white count, right? Okay. What disorder or organism is a killed vaccine used to trigger immunity? What would be that? What vaccine is an organism that is a killed vaccine? What is that?
What organism is a killed vaccine?
Yeah, what disorder or organism is killed as a killed vaccine used to trigger immunity?
Cyto.
A vaccination?
What's like a, more like a killed vaccine who's alive, right? What would it be? Would it be, I'll give you an example. Would it be tetanus?
No.
The flu vaccine? Hepatitis B or human papillomavirus? No.
Hepatitis.
Who else said something else? Flu vaccine. Okay,
She keeps saying
so know what the flu vaccine does.
You said it's used to kill.
It's the only vaccine for influenza has been inactivated. It's considered a killed vaccine. Okay, and it's in the book. Take a look at 177.
177.
How long is the drug therapy for somebody with active TB? How long is it then?
6 months or more.
Okay, yeah, very good. 6 months, right?
Active
Long time. Yeah. Drug therapy, what's the minimum course of?
6 months.
6 months. Okay, I'm sorry, repeat the question. How long is somebody with TB, active TB on drug therapy?
Always at least.
Okay, it's a long course. Right, what's the most common drug they get? Does anybody know? What's the most common drug for that?
Does it start at I?
INH? Most common thing to get. Okay, let's see, what else I have here. What does it mean by, what's the term that means elevated blood sugar?
Hyperglycemia.
Okay? What's the term that means low blood sugar?
Hypoglycemia.
Hypo, right? Okay. Just know what, how does insulin lower blood glucose levels? Know what it does. How does it lower it? Insulin binds to the insulin receptors on cells, and the cell membranes become more open to glucose, and glucose transport proteins in the cell membranes become more active, and the overall result is movement of glucose in the cells, which lowers the blood glucose levels.
What page is that?
And that will be on page 220. Know what the main reason why that insulin is needed as drug therapy for people who have type 1 diabetes. Know the reason why people are getting insulin for type 1. Okay. They no longer produce insulin, right? That's because the beta cells of the pancreas are destroyed and they don't produce insulin anymore. What would be the most dangerous adverse effect of insulin? I'm sorry? Excellent. Did you say hypo? Excellent, yeah. What is the most dangerous adverse effect of insulin? When you're giving somebody insulin, what is the most dangerous thing that could happen to them? Why do we make insulin a high alert drug? Why do we do that?
If given an incorrect dose, it could cause death.
Yeah, absolutely. Absolutely, very good.
Can cause death. A high alert drug.
Yeah, a high alert drug. Why do we consider insulin a high alert drug? Because if we give too much, we can really hurt somebody, right?
Yep.
Okay. Know what the side effects of insulin therapy are. No, 23.
What page is that?
Know what the side effects of insulin therapy are.
And what page is that on?
That will be on 215.
Thank you.
Yeah. Know what the major symptom of low blood sugar levels, what would we be looking at? And that's something I'm probably gonna use, like even like a cholesterol. Like what would be the side symptom of somebody who's had?
Shaky.
Of low blood sugar levels.
Okay, what would be? Would it be hypertension?
No.
How about weight gain?
Yeah.
For somebody with low blood sugar?
No.
Okay. How about flushed skin?
Yes.
How about confusion? What would be the best answer?
Flush skin.
Okay.
What is it? Flush skin?
Flush skin.
Confusion, yeah. What would be a place when you're giving an injection of insulin?
She's just saying yes to everything.
Where you do not want to give an injection?
Where not to inject?
Not to inject. Where do we usually give an insulin? Belly, right? Where else? Right, it's sub-Q, right? Okay. How about on the umbilicus?
No.
Okay. How about on the outer thighs?
No, you can do it.
Okay.
Yeah.
Upper arms?
Yeah.
How about lower back?
No.
No.
Okay. Could, but it's very rare that we do that. How about what happens when somebody has a goiter? What does that mean?
Wide neck.
Hypothyroid.
Too much iodine in their diet.
Thyroid, right?
Or too little.
Swelling of the neck.
So
Okay.
too little iodine.
What mineral is critical for thyroid?
You said too
For
little
making
iodine.
thyroid hormones? What's the mineral? What is it? Okay.
I didn't hear the question, I'm sorry.
What is the mineral that's critical for thyroid? To use in making thyroid hormones? What is that? So somebody that they've been on antibiotics for 3 weeks, and now they have like a cottage cheese-like coating on their teeth, gums, and roof of their mouth. What do you think that means?
Thrush.
Thrush.
Okay. And what would you do as a nurse? What would you do?
Diflucan?
You would want the patient to do?
Rinse.
Rinse, maybe like frequent mouth care, right? Okay.
I don't know, when I went to clinical,
I'm sorry?
patient.
You have somebody?
No, when I went to my adult daycare,
Yeah.
the nurse told me that when they do have the therapy, she let them.
They have like a swish and swallow, and they, yeah. Yeah, they usually will give some of that stuff. Well, you wanna do frequent mouth care. What would you do with the nurse if somebody tells you that they've been taking antibiotics for a couple days, and now they're telling you they have a skin rash over their chest, arm, and back? What would you do? Okay. What else? Would you ask more information from the patient? Okay, yeah, okay, you ask more information from the patient. Okay, very good. Let's see. Somebody's been on antibacterial therapy, and what assessment finding in the patient indicates the therapy is effective? We should be looking at red blood cell count, white cell count, wound drainage, or temperature.
White cell?
I'm sorry?
White cell count?
Yeah? Okay.
What was the question?
If somebody who had a bacterial infection is placed on antibacterial therapy, what assessment finding would tell you that whatever drugs that they're getting has been effective? Okay?
What did you say the answer was?
White blood cell
cell
count. Mm-hmm.
A normal white count. You have a patient who's taking the antiviral drug, what would be something that you'd like to teach them about when they're taking that? What do they tell you not to do with that drug?
One question.
I'm sorry,
Not to stop taking.
who said that?
Diana?
Excellent. Yep. You want to make sure they take it as prescribed and then long, right? Right, they don't want to stop it. For somebody to have active TB, what kind of things would they need to have? Example, TB test, would that be positive or negative?
Positive.
Okay. Would they have, what about a chest X-ray?
Yes.
Positive?
Yes.
Okay, what if they have a progressive cough?
Yeah.
Okay. What if they just had a positive TB test? Would that mean that they have active TB?
No.
No, okay, good. Let's see. So know about diflucan therapy when somebody's getting that, and what lab values that you want to make sure that you report. If somebody's getting diflucan, which is, yeah, diflucan therapy, so somebody's getting that.
And know what lab value?
Yeah, it was important to make sure that you report. If anything's out of the ordinary, so just know what things you need to report to the doctor. What page is it? That would be on page, let's see, 167.
Can you type it on that?
Just know that this drug can affect how the kidney reabsorbs and excretes potassium.
Diflucan?
Yeah.
Potassium centers?
And it absorbs and excretes potassium. Okay.
The kidney better when you use it?
I'm sorry?
It can affect the kidneys.
Yes, that drug can affect how the kidney reabsorbs and excretes potassium. Okay, so now remember we talked about insulin, and we talked about, like the peak times. Remember I told you guys that to make sure that you knew that, there's like a table in your book. So if somebody's receiving Humulin 70/30 at 7 in the morning, what time should you expect the peak action? What time would that drug peak?
Within a half an hour? 8 o'clock?
So if they're getting it at 7 in the morning, you think it's gonna peak in an hour?
Oh, 7:20.
Okay. What would be the range? 70, for that one?
70 to 30 minutes.
Right, it's an immediate acting drug, right? And the peak action time is between what? What do you think that one would, this drug would peak at? Usually it's between 6 and 10 hours. Okay, so if we're giving it at 7, say it peaks at 6, and 6 hours later, what would that be? 1 o'clock, right? 6 to 10 hours, that's usually when that drug peaks. So know that your range would be what, 1 to what? Like 5?
And was that Humalog?
Humulin, 70/30.
Humalin.
What page is that on, everyone?
You wanna look in your
Maybe
book?
it's the same
Section
thing.
14.
Just different name.
Unless one is the short acting and one is
Yeah.
long acting.
You know, the peak times, remember we talked about insulin? So with the peak times, all your insulin, so you're gonna be using that a lot. Okay, what would be the, most important precautions to teach a patient who's on insulin therapy? Avoid sharing needles with family members, do not skip meals when taking insulin, always refrigerate your insulin, or avoid eating carbohydrates.
Sharing refrigerator.
What would be the most important thing?
Refrigerator.
Precaution,
Precaution.
to teach your patient who's on insulin therapy.
Repeat the option.
Avoid sharing needles with family members, do not skip meals when taking insulin, always refrigerate your insulin, and avoid eating carbohydrates.
Do not skip meals.
Skip meals, yes. Nope.
It's more important than not sharing. Well, yeah, it's because it's a family members. So you would know your, no, it's not, but what's the
Skip
most
meals.
important one?
Okay.
What is the what is the normal range for a glucose level?
No.
Okay. And what would be 40, would that be low?
Yes.
Yeah. Okay, and what about 80?
Normal.
Normal? Okay, what about 160?
High.
High, okay, all right. So know what your normal glucose level is.
What is it? Is it 80 to?
7110.
70 to 1.
7110 is normal, right? What is the most common drug for somebody who has thyroid issues?
Synthroid?
Or what's the other name for it?
Synthroid?
Okay. So know what your hypo and hyperglycemia is, and hyper and hypothyroid. I know those. So as you know, there'll be drug questions on here, there's always 5, right?
Questions.
Any questions at all?
Definitely.
Hypo and hypo.
That's what the
Hypo and
chapter.
hyper. Thyroidism, hypo and hyper.
The same
Glycemia. Okay.